You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with dental implants. We've had him on the program before. He is Florida's go-to implant dentist. In fact, people from all over the country, all over the world, fly in and see him to get a brand new set of teeth in just one day. He says nobody should be wearing a loose-fitting denture. With us, we have Dr. Matt Holtan. Dr. Holtan,
thanks for having us. Thank you for having me.
Is that true? People do come from out of state to see you?
Absolutely. Well, don't forget where we live in Florida. It's a sort of a seasonal destination, and people come from all over the country. They go back. They talk to their friends about things we're able to do for them. What you find out about a lot of medical procedures is if you know somebody and you trust them and they had success with a procedure or a practitioner, then they seek that person out because they know, they trusted their friend, so in turn they'll trust you.
Now, when we know you're coming out, right, and we're talking, it's like you're always somewhere learning more about implant dentistry. You were just in Greece, and I have to ask you, is there really that much to it? Where you're nonstop learning more new, and what are you learning that makes it, what does it make it faster, better, what?
All of the above. The big transition that we've had in implant dentistry especially is the digitization of the technology. So it helps us guarantee people's success. It allows us to be able to do things faster in few appointments, and the most important thing, Randy, is the results we're able to produce are that much better. By using the computer, we're able to integrate photographs of people's faces with the things that are happening in their mouth, and so the results are exceptional.
So, like the computer, and we're talking about it. And I'm paraphrasing you slightly, but with the technology that you have, that less than 1% of all dentists have,
right?
That you couldn't create the smiles that you're creating without this technology.
Well, don't forget, everything used to be made by hand. And as soon as you were making things by hand, there's some variability in the results. You'd have a technician there that was setting things on a model, and they weren't able to look at the patient's face. Now with digital technology, you've got so much information that it's essentially like the patient is in the laboratory with the technician. They're making changes on the models, and you can see that reflected in the patient's smiles. And you'll get to see a little later when we go through photographs, is I can guarantee aesthetically that we can achieve a desired result.
They look good.
Some people want teeth that look natural. Other people want teeth that look more Hollywood.
Okay.
And usually there's some happy medium in between that you're able to provide for people.
And you're one of the busiest guys in this country doing this procedure. Is that true?
Absolutely. I'm doing this every single day. I'm a board certified dental implant specialist.
Okay.
So some people you hear of, they go to multiple different offices. They go to one guy to do part of the job. They go see somebody else to finish the job. In my office, I'm the only doctor that you see. I think because of that, not only can I offer people a faster, or I should say a shorter treatment time, but because there's less people to pay, I think our costs are more affordable too.
Is that true? No more dentures? Like the future is like dentures as we know them just won't exist?
Randy, no one needs to wear a denture. The very few people that are really, that I'm unable to help are people that have medical problems that are far beyond the scope of them wanting teeth.
But do you turn people away, or that's so rare you haven't even had to do it?
No, those people typically understand that they're not even, it's the people that have had different types of cancers and head and neck radiation that their doctor has said, you're not a candidate for dental implants. People that have been told they don't have bone, almost every single one of those people is a candidate for dental implants. Now the difference is the doctor that told them they don't have bone was kind of maybe not as advanced in their capabilities to provide some of the more newer, advanced no-bone solutions, like the zygomatic implants and things that you've heard of.
Okay. So and by the way, because look, I interview a lot of people on this show, and there are certain people that, and that's why I wanted to have you on the show.
Right.
People need to know I'm not trying to side with you. I'm just asking you the questions. But typically, this process could take 8 to 12 months, and they don't tell you that. And you're telling, and I even have people say, kind of like what Dr. Holtan is doing. I don't know if he's doing it as quickly as he says, but literally, if you had time on the schedule, things like that. I mean, you could do this in like as little as 3 appointments, maybe even 2 appointments. You said.
Absolutely. The old techniques, it could take up to 2 years. People had to be transitioned through dentures.
But they're still doing that today?
But they're still doing that today. Okay. And it's not necessarily that somebody that's doing that is wrong. There's just more advanced ways to do it.
I want to ask you this question this time. Bad gums. I mean, if somebody has really bad gums, can they still get this? Or the implants are more likely to fall out?
Absolutely. If somebody's been told that they're going to lose their teeth and they have bad gums, the reality is the reason they have bad gums is because of the bad teeth. When you take the bad teeth out, you eliminate the disease, and you can still usually provide those people with teeth all in one visit.
Do their gums get healthy?
Absolutely.
Because
when the teeth are gone, the bacteria are gone, and they can achieve a level of success just as much as anyone else that had perfect gums.
What do you understand now? Because you've been doing this 13 plus years. What do you know or get now that you didn't get back then, or even just 5 years ago?
I think the main thing that I understand now and try to focus on more than anything is how important this person's smile is going to be to them and to their life and to the people that they surround themselves with. As a dentist, we tend to get technically focused on little details, and when you start talking to people, you're talking about all these details, and the patient's looking at you, and what do they want? They want teeth that work and teeth that look great. And when you talk about people's smiles, and we show some of these photos today, I can tell you stories upon stories of how people came to me and they were one person, and they maybe lacked some self-confidence. They were worried that everybody had told them they weren't a candidate or they wouldn't have success. And when you get to see these people and you follow up with them and you help them maintain all the things that they've done, they become different people.
Really?
Their smiles become contagious. Everybody's read the studies that show that when you smile, your chemicals, inside your body, help you with a greater sense of well-being. They help you, obviously, and that greater sense of well-being is transmitted to all the people that are around you.
When you give somebody brand new upper and lower teeth, what do they like more, the way it looks or what they could eat?
Well, I think it's dependent on the person. For the most part, the smile means the most to people. Now, when you got a guy that comes in and the first thing he tells me is, I haven't been able to eat steak in 10 years. Obviously, I'm going to focus more on that patient of getting him really strong, functional teeth from the get-go.
Okay.
But a lot of the gals that come, the functional part seems to be more of a byproduct. They're most concerned with the smile.
The appearance.
Their grandkids looked at them and said, "What's wrong?" Even they know something's kind of going on. But then, when it really comes down to it, they love the way they can eat things, and really eat things that help them nutritionally. They can eat salads. They can eat raw vegetables. All the things that.
So when you have bad teeth, you can't really eat salads.
If you have bad teeth or you're wearing removable teeth, there is a list of things that those people don't even attempt to eat because it's so difficult.
Okay, good. They try to give you credit, you say, for changing their lives.
Well, really, Randy, they're the ones that really deserve all the credit because they're the ones that made the call. They went out on a limb to do something. They were obviously a little bit worried about what might happen, but in the end, they're the ones that benefit. And so we love helping people. It's interesting for me because right when I meet them, I know the type of success they're going to have. And
you could see it?
And it's trying to get them as excited as I am about it, knowing that their results are going to be so fantastic, and also the way those results are going to make them feel.
You told me in the green room, it's like they think it's just maybe getting brand new, good-looking teeth, but it's so much more than that. Like you feel that when you're talking to them.
It's so much more than that. I mean, you've seen the benefits that having a great smile has in terms of confidence. How about the people that haven't been going to restaurants for years because they were afraid that they couldn't eat the food? Okay. So now, one of the regrets I hear people say is certainly that the biggest regret they have with this procedure is that they wish they would have done it sooner. Okay. They went 5 years not going to social events with their friends because they were afraid that they were going to lose a tooth or something was going to happen. Absolutely. People that had loose dentures or people that had bad teeth. And now, Randy, they were worried that they couldn't eat anything, and now they can eat whatever they want. And in fact, I even had one gentleman a few weeks ago that was telling me this has cost more than he ever thought because him and his wife go out to dinner.
What's it like when it's all done and they look at themselves in the mirror for the first time? What's that like?
Well, Randy, for some people, it's obviously very emotional. They'd been worried their whole life that they would never get back to the way they looked, as a young guy or a young girl. And now here they are in a later stage of life. Your health is deteriorated in other parts of your body. Your face doesn't look the same. Your body doesn't look the same. And here they are. We can deliver to them an exceptional smile. And it's just, it's transformative. Good. It's really transformative.
That's good. Let's take a look at some of the photos.
Okay, great. This is one of the most transformative reconstructions I think we've been able to do. And when you talk about changing someone's life and changing who they are, he was a little bit of a shy guy, and I didn't really develop a great sense of rapport with him when we first met. I felt like maybe he was even just a little bit guarded. He was worried. His teeth had really fallen apart on him, and he didn't know where to go. He didn't know who to trust. And
those teeth look pretty bad.
Yeah,
is that common, like what you see a lot of in your office?
We've seen everything.
Okay.
We've seen everything. And at the end of the day, this gentleman has the most exciting personality. He comes to the office, he's flirting with the girls. His wife has told me that he's a much let's just say more complicated to deal with around the house because he's so excited. He wants to go places and do things. And it's really brought out a new person inside him. And it's been really great to get to spend time with him. Yeah, so Randy, look at the before and after. I mean, would you say that he's more handsome now?
Yes.
Right?
Yeah.
And I think the important thing you see with him is that you really couldn't see any of his teeth before. What do they do in the movies if they want to make somebody look like a bad guy? Right? If you didn't see the after on this guy, you'd maybe think he wasn't very happy, maybe he was a kind of mean guy, or whatever Hollywood would associate that character with. And then you look at the after and you can see he's a great guy, he's a happy guy, he's a nice guy.
Now with these patients we're looking at, are these snap-in, snap-out teeth supported by dental implants?
All of the teeth that we make ideally are fixated teeth. Nobody was born with removable teeth, right?
So you don't like those snap-ins?
It's not that I don't like them, Randy, it's that patients don't like them. And I want people to have success. So if somebody comes to me and wants me to do removable teeth with 2 implants and snap-ons, what I tell them is that you're coming to me looking for my opinion on what we can do to help you. And if I do that, it might not help you. And then, as you know, they might be upset thinking that you did a bad job when the reality is you need at least 4 implants a jaw. You can have teeth the same day. You never have to
don't come out.
Never come out. That you don't have to transition through a denture. And you go, and as soon as you wake up from the operation, you can bite into an apple.
Okay.
So
now, is it true? So a lot of the new dentists, when they're starting out in implant dentistry, start with the snap-in, snap-out. Is there a truth to that?
There's a truth to that. The fixated implant procedure is more advanced. It takes more advanced levels of skill. That being said, it's the most successful.
Okay.
Not only in the short term, but also the long term. So when these people come to me, even a patient in their 60s, they potentially have to live for another 30 years. I'm not going to set them up for failure. I want people to have long-term success. And the reality is I'm young enough that I'm still going to be working if something I do doesn't work. And they're going to be back and they're going to be asking, why didn't we do the other thing that was better? Randy, this is a really sweet gal. And as you know, everybody has different things that happen to them in their life. And this gal spent a very large percentage of her time taking care of other people that were sick and that were having issues. And so you neglect yourself. You've heard this a lot with parents. They just forget about themselves and they focus on the kids. And sometimes what we do, Randy, is we can show people a simulation of what they're going to look like when we're done, before we even start the procedure. And she didn't believe me. She downright didn't believe me. And it was almost a little bit of a challenge for us to be able to deliver this for her. And you can see she's got a really big, bright smile. Her personality changed immediately. And so, Randy, do you think she's more attractive? What do you think?
Yes, of course.
Absolutely. Well, everybody thinks that,
But that happens to everyone, you say. Well, guys become more handsome, women become more attractive.
Absolutely. And there are different levels. Not everybody wants to have a really bright, showy smile. Some people say, Doc, I just want to get back to where I was, in my 30s. Let's do something with some component of natural teeth. So the important part is the subjective nature of teeth, which is that some people have teeth that look different. You can still reproduce. Good. So some of the people that we treat have other things. And this gal had always been really afraid of the dentist. She'd had some problems happen when she was younger. And I remember she was very, very afraid.
Her teeth look pretty good, though, in the before.
The problems are never, at the surface. And so, sometimes genetically people have problems with their teeth. And so in this particular case, she was worried about being hurt again, like she was when she was a kid. And so, having anesthesia professionals in the office, being able to sedate people throughout the entire procedure, you wake up and you've got your teeth in your mouth. And in most cases, you only have to do one surgery, one time. And like you said earlier, in as few as 2 and 3 visits, you get your permanent
So this
teeth.
woman, those teeth I'm looking at had to be removed. She would have ended up in a denture.
Absolutely.
Was an option.
Absolutely. It was the only option. It was the only option. And so for most people that are having issues with their teeth, you're basically torn between dentures, which we know don't work and have very limited levels of success, and dental implants, which we know have almost guaranteed success.
What does she say when it's all done?
Well, what she said was she can't believe that she waited so long to have this done. She sat at home in fear, afraid that this was going to be, a painful thing, a difficult thing for her, and she told me she wished she'd done it 15 years earlier.
Now, we have to mention this because we get emails about this. Even the best dental insurance does not cover this procedure.
Right, but people are financing this.
Okay.
And Randy, there's multiple different ways that we have that can help people afford treatments
Do they
like this.
finance it?
Some people
Percent,
finance
like
it.
80%?
Most people finance it. Some people like to write a check. And
Okay.
usually, in those cases, we'll usually give them a discount based on writing a check. But one of the important things about coming to meet us into the office is not only do you get to meet me and be evaluated and find out if you're a candidate, but you also will get a detailed treatment plan, which will have multiple options at multiple different price ranges. And at that same visit, the gals can talk to you about financing. You can see what it would cost so that you can get really your head wrapped around all the different details and hopefully make a decision so we can find a way to help you fix your teeth. Randy, Jim came to see me in the height of the pandemic, and he was at really the end of the line with the problems he'd had with his teeth. You can see he was missing some teeth. He wasn't able to go out and eat the things he'd like to eat anymore. He was a super social guy. He liked to go meet his buddies out. He'd kind of developed a little bit of social anxiety about wanting to be out there. And he's one of those guys, kind of like you, and when he smiles, you see everything. And he can't not smile because he's a really happy guy. And so he didn't like the fact that people were getting a negative opinion of him because they thought he wasn't happy if he wasn't smiling. And the reality of it was, Randy, is that he was headed for a denture. And in fact, I think he'd already met with another dentist who had told him that was his only option. So then he thought, well, geez, I got all these problems now, and it's only going to get worse. Now I can't eat anything. And so when we finally got to meet, we talked about different options. On his lower jaw, as you can see, we just fixed teeth. So that's traditional restorative dentistry. Not everybody needs to have their teeth removed. As you're finding with some of the corporate centers these days, they only have one treatment plan. Let's take all your teeth out and do dental implants. In this particular case, the teeth that were bad, that had to be removed, we replaced with dental implants. And the teeth that were good, but maybe didn't look as great as he wanted, we were able to restore with ceramic crowns. And you can see the result is fantastic.
Looks good.
He comes to the office. He's flirting with the assistants. He's giving me a hard time, and it's really a great thing to see how it brought him back to his old self. And he's hanging out with his buddies, going places, and it's really a great.
I like what you say. The most expensive part about the procedure is going out to eat and traveling. And all these things. It's kind of like when those guys get their hair back.
Absolutely.
They're all over the place,
Absolutely.
selfies, on Facebook with selfies.
You hear stories from people's spouses. He was a lot easier to deal with at the house when he didn't want to go out and his teeth were bad, and now you're going out to restaurants and bars and hanging out with all his old friends, and it can be tougher.
So now on the consult, what's the best way to get in touch with you? Do they go to your website? Do they call your office?
As you'll see, you can fill out the form online, and one of the gals will give you a call, or as they call the office, they'll get to talk to somebody. They'll ask you some questions based on your needs, and then the opportunity for a no-fee consultation to come meet us. You get all the imaging that I need to evaluate the situation. You talk about options. There are usually multiple options that I'll present to people.
Okay.
And then at the end of the visit, one of the team members will come in, talk about all the financing options, and also, you get to see a total picture of the different options. And if right then and there people decide they want to have the procedure done, usually the next visit, we're doing the work and they leave the office with the teeth that stay in their mouth.
How old can you be to do this? Like, what's the upper age range?
Randy, we've done this procedure on people well into their 90s.
Why would a 90-year-old want to do this?
Yeah. Well, Randy, as you know, if you're 90 years old and you've been able to eat and chew your whole life, well, why would you want to stop?
Okay.
I mean, you don't want to go backwards.
Fair.
As you get older, it's very important for you to have teeth that work. Forget about how they look.
But
you
with
need
90, they're not more likely to fall out? Statistically?
The teeth don't fall out. These teeth are fixated permanently.
Okay.
In fact, we give patients a written warranty that guarantees their success.
Yeah, but what about, statistically, if you're 75 plus, you're on 4 medications on average.
Yeah, well, Randy,
can you work with those people?
Well, one of the important things is when you come to meet us, we don't just talk about your teeth. We talk about your health, and everybody has obviously different situations. But there are people that are on tons of medications and can have this done. People that have blood thinners, in some cases, don't need to go off the blood thinners. Other times we get with their medical doctor and we just decide to discontinue it for a few days, just as if you were going to have any procedure at the hospital. But the reality is, the only things that will ever preclude a patient from having something like this done is really things that happened with cancer and they had radiation to their head and neck, which really means that some other things should be done.
Now, what are their fears? Like when they come in, I mean, you've done so many of these consults. What do they want to know? Like, are they all worried about pain? Are they worried about downtime? What are they worried about?
I think it depends on the patient. Some people are most concerned that you can achieve the desired look that they want. And I think it's important for me to show them lots of pictures, just like we're doing today, of people that kind of reminded me of them that maybe had the same problems, and you can show them, what type of results to expect. But other than that, I think certainly with any medical procedure, people have an inherent level of, anxiety about what's going to happen. The reality is I use anesthesia professionals in my office. I don't do the sedation, so that you've got people monitoring the patient.
Like IV sedation.
Making sure that they're healthy as I'm focusing on a successful procedure.
What about when I interview guys at this table and they say, the pill's all they need? You disagree with that?
Yeah, the pills would be very unpredictable. And, it's one thing if the pills work for people, and that's great, but you're going to have a large percentage of people that the pills don't do the job. And now you've got somebody that's really anxious, that's expecting to be comfortable, and they're not comfortable. And I don't know about you, but I don't want to work on those people. It's not a great environment.
IV sedation is the way to go. And you're monitoring what?
Well, you're monitoring everything. You're monitoring their blood pressure. You have a 3-lead EKG on. You're measuring their pulse oximetry. And like I said, the anesthesia professional is there with their eyes on the patient and the monitor at all times. And me and my support team, we're working on the procedure, accomplishing all those goals. Very commonly, I meet patients that have been told that they don't have the bone for implants. And so they were either told, you're absolutely not a candidate, you have to stick with your denture, or that you have to undergo very costly, potentially uncomfortable, and very slow bone grafting. So you go through a surgery and then you have to wait another year before you can have implants, and you have to wait, and the process can extend to 2 years. And this gal, we were able to provide her with what I call a no-bone solution, using a more advanced type of dental implant. And so when other people would have required a more costly, time-inefficient protocol in one surgery, these folks can get the implants and their teeth, and in a very short period of time, usually 3 visits, can have their permanent teeth, and they're done.
It's a very pretty smile. Very nice.
She looks fantastic. She looks great. And Randy, we don't just get lucky some days. When you really start to kind of delve deep and look at what makes a smile, exquisite, you look at how the canine teeth are. They have to be a different shape than the front teeth. A little pointy. You want them to come close to the lower lip. Then you look at the way the front teeth are positioned. You want them to match the curve of the lower lip. And so in this particular case, obviously, just by augmenting the color, you're able to make a massive difference. And you can imagine, Randy, when she sees herself for the first time, and her family and her friends see herself for the first time, they were just blown away. And it really made me happy to hear that.
You say sometimes they don't even know it's the teeth that was changed. Like, what did you do?
Well,
is that right?
Absolutely. In this day and age, with all the other medical procedures people have offered, the teeth seems to be one of the first things that people look at when they're evaluating you. I know for me, because I'm a dentist, when I look at people, the first thing I notice is their teeth. Randy, sometimes you've heard of people that have been subjected to so many dental procedures in their life that they get really frustrated that it's this nonstop process. You go to the dentist, you need 2 teeth work done. Then you lose 2 teeth. Then you have to have root canals. Yeah, and she was sick of the never-ending cycle of dental treatments. She wanted a more permanent solution. She wanted a solution that wasn't going to require this constant maintenance. And so what we're able to do in a single visit is remove the bad dentistry and place implants on the top and bottom jaw with teeth the same day in a solution that, other than coming, every 6 months or every year for a maintenance visit, I believe will last her the rest of her life. And certainly the smile is a byproduct of that. You can just see there's no more multiple colors, the curvature is off, and now you've restored her back to a place where I'm confident where she'll have a very long-term success without the never-ending treatments.
We have time for one more.
Okay, can I just show you 2 more?
Okay, quickly.
This gentleman was presented with one option, and that was snap-in, snap-out dentures. And when we really dived deep into it to talk about the solutions, he realized that's not what he wanted. He wanted fixated teeth. And so I remember his family was a big part of the process. And as you can see, from the before and after photo, the real thing that changed with him is what he was able to eat. He was more focused on that.
Looks good.
And his wife ended up being so happy with the way he looked that she was ecstatic with the result. Randy, this gal had been through lots of dentistry, had lots of dentistry deteriorate over the years through no fault of her own, and eventually she got to the point where she wanted a more advanced aesthetic that wasn't going to age like your crowns or fillings might. And so what you can see here is with the result, it's certainly more homogeneous, it's brighter, the teeth are a little bit more showy, and as you can see, she got a really exceptional result.
It looks good. Final message, somebody watching this, they're either wearing a denture, headed to a denture, or they just have really bad teeth and gums. They've heard what you have to say, maybe they've seen you before, but they're still afraid or can't get themselves to do it. What do you say to them?
What I say to them is that it doesn't cost you anything to find out what your options are. And like anything in life, once you have the options, then people can make an informed decision. The reality is most of the people that we work on tell me at one point they were at home wondering what to do, uncertain of the results, uncertain of who to go to, and their primary regret is that they didn't do it sooner. So this is lifetime dentistry. And the results, obviously, in terms of what we can make you look like, and also the benefits functionally are tremendous.
Okay, good. I want to thank you for coming to the
Thanks,
show.
Randy,
Good job.
for having me. See you.
You've been watching the Wellness Hour news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.